chapter focuses on respiratory diseases. Our respiratory tract is divided into our upper respiratory tract, which includes the mouth all the way to our larynx or voice box, and our lower respiratory tract, which begins at our trachea or windpipe and extends to the alveoli in our lungs. We have some built-in defenses in our respiratory system. They include nasal hairs that can trap microbes, cilia that can move particles out, as well as mucus, which can trap pathogens. We also have our second and third lines of defense present. There are many types of organisms that we can find in our respiratory tract, particularly the upper tract. They include bacteria as well as fungi. The upper respiratory tract has thousands of microbes, and even our lungs have microbes present. Some normal flora like Strep pyogenes and Staph aureus do have the ability to cause disease. Yeast are also present as well. Patients who suffer from respiratory ailments have a different microbiome in their lungs, as well as smokers. Our normal microbiota, as you know, competes with pathogens so that they can't establish themselves and cause disease. Our first disease is pharyngitis, also known as strep throat. Symptoms include an inflamed red throat, pain when swallowing. Typically, a sore throat caused by a bacterium is more painful than one caused by a virus. Viruses that cause the common cold can cause pharyngitis, but the most serious cases have Streptococcus pyogenes as the causative agent. Strep pyogenes, if left untreated, can result in scarlet fever. This infection arises if S. pyogenes has been infected with a bacteriophage. Symptoms seen include a sandpaper rash and fever. It has a very high mortality rate in epidemic form. Rheumatic fever is also a complication of strep throat, where antibodies start an attack on the muscle of the heart. S. pyogenes can produce antigens that resemble our proteins and have superantigens. They also have polysaccharides as well as lipoteichoic acid that can be used to attach. They have a variety of factors that help them to evade the immune system. Here we can see the structure of S. pyogenes. You can see a variety of virulent factors. S. pyogenes can also produce streptolysins, which cause lysis of cells. It also produces an erythrogenic toxin that causes the rash as well as fever. Roughly 30% of sore throats can be attributed to S. pyogenes. The mode of transmission is through respiratory droplets or direct contact. About 15% of us have this bacterium as part of our normal biota. There are more than 80 serotypes, which explains why people may have frequent infections. Pharyngitis can be diagnosed with a rapid strep test, along with growth on blood agar. There's no vaccine, but preventative measures like good hygiene as well as covering your mouth when coughing or sneezing. Penicillin is used as treatment, while those who are allergic may take cephalexin. The common cold can be caused by over 200 types of viruses. The mode of transmission include both indirect contact and droplet contact. Symptoms include sneezing, itchy throat, runny nose, and possibly a fever. Treatment is simply supportive therapy to treat the symptoms. Sinusitis is also called a sinus infection. It can be caused by viruses, bacteria, or fungi. Allergies may also lead to a sinus infection, as some of you may have experienced. The mode of transmission may be direct contact, indirect contact, or endogenous. If the infection is caused by a bacteria, a broad-spectrum antibiotic may be prescribed. An antifungal is prescribed if the causative agent is a fungi. Acute otitis media is an ear infection. Upper respiratory tract infections caused by a virus may lead to a buildup of fluid, which allows bacteria to replicate. Some causative agents include S. pneumoniae, Haemophilus influenzae, and others. Prevention is with the Prevnar vaccine. Depending on the severity of the infection, no treatment may be needed, or antibiotics may be necessary. Those who suffer from frequent infections may need tubes in their ears. In this image, we can see the inflamed eustachian tube, fluid, and bulging eardrum. Diphtheria is caused by the bacterium Corynebacterium diphtheriae. Its mode of transmission includes droplet contact, direct contact, as well as contaminated fomites. This bacterium developed a toxin after being infected with a bacteriophage. Its characteristic symptom is a pseudomembrane on the pharynx. If untreated, it can close the airways. Luckily, we can prevent this disease with a vaccination. Treatment options include an antitoxin and penicillin or erythromycin. Influenza is caused by a virus. Some strains have the ability to cause pandemics like H1N1. The symptoms include headache, chills, muscle aches, fever, and a sore throat. Oftentimes, secondary infections like pneumonia are seen. The causative agents of the flu include influenza A, B, and C. The hemagglutinin spike allows for binding, while the neuraminidase spike assists in release. Its single-stranded RNA genome gives the virus variability to change its glycoproteins. Antigenic drift arises when the glycoproteins or spike on the virus change. This is why each year a different flu vaccine is required. Antigenic shift involves RNA being exchanged by two different flu viruses. This occurs inside of a host and can lead to pandemics. Let's look at this antigenic shift. A pig is infected with a duck influenza virus and a human influenza virus. While in the pig, there is an exchange of genetic information which leads to a completely new virus which we have no immunity against. The influenza virus can bind to respiratory mucosa, which then leads to a cytokine storm, which leads to an inflammation, severe inflammation in the lungs. The mode of transmission is through droplet contact as well as indirect and direct contact. The drier air in the winter helps the virus to spread. Influenza can be diagnosed with tests in the clinic as well as real-time PCR. The flu can be prevented with a vaccine, and it's recommended everyone over 6 months should receive one each year. Research is being done to develop a vaccine that can target all strains and not be required every year. Several drugs can be taken, but must be taken early in the infection. Treatment includes amantadine, Relenza, and Tamiflu. Whooping cough is characterized by the bacterium Bordetella pertussis. The mode of transmission is droplet contact. There are 3 stages of pertussis. The catarrhal stage lasts up to 2 weeks, and symptoms include a runny nose. The paroxysmal stage includes intense coughing fits. The coughing is so intense that blood vessels may rupture. In the convalescent phase, bacteria start to decrease and there's no more symptoms. This can be prevented by DTaP vaccines, but boosters are needed. Cases are still common due to anti-vaccination and not receiving boosters. Treatment is with azithromycin or erythromycin. Respiratory syncytial virus, or RSV, is caused by the RSV. The mode of transmission is droplet contact as well as indirect contact by a fomite. It is a common infection seen in children under the age of 1. Antibodies may be given to vulnerable populations. Supportive therapy is the treatment. Tuberculosis has infected 2.5 billion people worldwide. There are 3 forms of clinical tuberculosis: primary, secondary, and disseminated or extrapulmonary. Primary tuberculosis only requires 10 cells, and the bacterium can replicate in macrophages. The damage seen in tuberculosis is caused by the immune response on the bacteria. It leads to a tubercle forming on the lungs. Extrapulmonary tuberculosis is seen outside of the lungs and other systems. Immunocompromised patients are more vulnerable, and this condition is often fatal. Secondary tuberculosis involves live bacteria that hide out and then reactivate. Symptoms include a cough with green or bloody sputum, fever, weight loss, chest pain, fatigue, and night sweats. Left untreated, they have a 60% mortality. The causative agent of tuberculosis is Mycobacterium tuberculosis, an acid-fast bacterium. The mode of transmission is respiratory droplets in the air. Several factors contribute to susceptibility, including nutrition, lung damage, and genetics. 60% of cases here in the U.S. are from foreign-born individuals. TB can be diagnosed by the Mantoux skin test, assays, culture isolation, as well as acid-fast stains. In the Mantoux skin test, tuberculin is injected into the dermis. A small bleb appears, and after 48 to 72 hours, the reaction is rated by the degree or size of the area. There are several categories, such as HIV status, whether an individual is an immigrant from a TB endemic area, or if no risk factors are present. There is a vaccine, but it is not used here in the U.S. Treatment includes several drugs, including rifampin and isoniazid. The big issue with TB is patients not taking the drugs as they should, which leads to resistant strains. Resistant TB requires treatment for up to 2 years with 4 to 6 drugs. Those that have multi-drug resistant TB are sicker and have higher mortality rates. Pneumonia is a situation where fluid accumulates in the lungs and waterlogs the alveoli. There are different pathogens responsible for pneumonia, and more children die from it compared to other infectious diseases. There are several etiological agents that cause community-acquired pneumonia. They include S. pneumoniae, which is a major cause, Legionella, Mycoplasma, Histoplasma capsulatum, as well as the hantavirus. Streptococcus pneumoniae is a bacterium that can cause pneumonia in several scenarios. They include old age, season, underlying conditions, and drug or alcohol use. There is a vaccine. Legionella pneumophila is a bacterium found in tap water, cooling towers, fresh water, and spas. It is resistant to chlorine and has been linked to supermarket vegetable sprays. Its mode of transmission is through a vehicle. There are some pneumonias that don't resemble the typical symptoms of pneumonia, like the fever and coughing. Mycoplasma is transmitted via droplet contact, and it's called walking pneumonia because most patients don't have any symptoms. The hantavirus can also cause pneumonia. The Hantavirus can also cause pneumonia, and its mode of transmission is airborne dust contaminated by excrement from infected rodents. Viruses are also a common cause of community-acquired pneumonia. The mode of transmission is droplet contact or endogenous. About 1% of hospitalized individuals experience pneumonia. It's most often associated with mechanical ventilation and has up to a 50% mortality. MRSA, Klebsiella pneumonia, E. coli, and Enterobacter are common causative agents. Treatment is with antibiotics. It's important to elevate the heads of the patients to prevent aspirations, to teach the patient about deep breathing, and to properly clean and maintain ventilators.